Good morning, everyone. It's about right time to get started. So good morning to everyone who's tuning in from the US. Good evening for anyone who's tuning in from Asia. My name is Sarah Riviello. I'm a business development manager for KMC Solutions, and I work here in Manila in KMC's headquarters. I grew up between New Jersey, lived in California, and the Philippines, and I've been here in Manila for the last 10 years, having worked in tech, finance, film, offshoring, startups. So I now currently work on John's team, and I'm focused on major US accounts. John and I work together on any and all aspects of a client build out to support their growth and ongoing operations in the Philippines. Um, the pandemic has brought forth significant challenges that, together with our clients and the KMC team, we have been very successful in addressing these to allow for their continued operations. We've got 1 hour together and lots to cover. So without further ado, I'd like to turn this over to our Managing Director for KMC US Operations, John Chess.
Well, thank you, Sarah, and good morning, good evening to everyone who's been able to carve out some time to join us. I am the managing director of KMC's U.S. operations. I'm based in the San Francisco Bay Area in Northern California. Sarah and I and the rest of our team support our major KMC US clients, and we certainly are heavily involved in working with US companies looking to set up their own operations in the Philippines. As a bit of personal background, I began my career in the high tech industry here in the Silicon Valley. In the past, I've been a computer products manufacturing rep, a VP of sales for a memory board manufacturing company, a founder and CEO of a modem manufacturing company called Apex Data. I was the founder and board member of a company that manufactured switches and developed software for telecom service providers. That company was called Cosign Communications, and we were lucky enough to go public in 2000. More recently, I was the co founder of the industry's first offshore clinical healthcare BPO in the Philippines. That was founded in 2003. And we'll have a bit more on that later in our discussion. Now I'd like to hand it off to Jeff Williams.
Thank you, John. Hello, everyone. My name is Jeff Williams. I am a current board member and past chairman for the Healthcare Information Management Association of the Philippines, as well as an active participant in multiple BPM industry-focused activities. I'm also the co-founder and one of the executive leaders of Genfinity, a HIM industry-focused consulting and training firm that also provides traditional BPM services for multiple clients, and via our healthcare-focused GIC enablement service offerings, we've assisted multiple U.S. entities establish operations here in the Philippines. My affinity for the global services industry stems from the fact that in the late 80s, I started as a tech support rep, so I can feel their pain, per se, when knowing the industry. And I parlayed that into a director of worldwide IT ops that exposed me to the cultural challenges and opportunities of operating outside the US in places such as Puerto Rico, Scotland, Malaysia. And now I'm very happy to say that I can call the Philippines home for the past 17 years. So John, I believe we were just going to jump straight into the HIMAP presentation here, correct?
Yes,
Yeah.
absolutely.
Okay, so again, I would like to thank KMC and John, Sarah, everybody for providing me the opportunity to introduce HIMAP and to speak a little bit about what the healthcare information management industry is like here for the Philippines. So next slide. Okay, this is start off with real simple. Who is HIMAP? And HIMAP is the acronym for the Healthcare Information Management Association of the Philippines. It's a nonprofit industry association comprised of multiple HIM support service companies. HIMAP is overseen by a member-elected volunteer board of trustees and a small secretariat, and our initiatives are funded via membership dues and various fundraising events. Our mission is to promote, market, and represent the Philippine HIM support services in the global market by developing, adopting, and promoting the best practices in people, process, and technology. And our vision is to see the Philippines recognized as the global leader in health information management services. So next slide. This is we'll jump right into the meat of the matter here. what we do every 6 years, the industry, so HIMAP, I've told you, is for healthcare. There's other associations. There's CCAT for contact centers, BPAP for the IT aspects, PSIA for software development. All of these industry associations all get together under the one umbrella of IBPAP. And every 6 years we do a roadmap. And that roadmap is to foresee for the next 6 years, where are we going, what's working, what isn't working, what do we need to change, and how do we ensure that we're doing the best thing to see the industries grow. And we always consult on a third-party consulting firm to kind of come in and bring those numbers to us. So it's not just us kind of making up numbers and tooting our horn. These are affiliated by other, well-recognized consulting firms. And in 2015, we listed the Everest Group to come out and create our roadmap 2016 to 2022 roadmap to cover that 6-year period. We came off and it was very aggressive. It looked very good. The industry was certainly growing up a lot. But as you all know, there was some interesting worldwide political changes, some rapidly progressing technology, and some other global business factors. We asked Everest to come back in 2018 and maybe reassess our report because we wanted to make sure we were on track and not diluting, or maybe we're looking at numbers that were incorrect. So we did go and reassess. And from those numbers, I think it's important, if you look here now at the global healthcare, life and sciences market, services market, you'll see that in 2018, it was a $5 billion industry. And then for 2019, it was projected with 11% growth, and then a compound annual growth rate was between 10 to 11% over the next few years going into 2022. They projected these, Everest analyzed and projected these growth rates for the various Philippine industry sectors. And in fact, if you look at it, you'll see that the Philippines down below, because again, I told you the different sectors, you've got contact center, IT, GICs. Healthcare is resounding very solid with a 7 to nearly 11% growth rate projection versus some of the other sectors that are a little bigger and maybe been a little more established, but they're kind of, you're seeing right now the growth is happening in healthcare. And all these determinations were made before COVID, because we know COVID now is certainly having an impact on healthcare services and certainly in how we operate our businesses and how we change it. So next slide, please. Can we click one more slide? This is where it's important here to show that if for 2018, if the industry was $5 billion. Oh, no, I'm sorry, go back. I didn't want to, just wanted to show the next piece of that other slide. Go back one, please. There we go. You'll see in, oh, one more click. There we go. If you look at the $5 billion industry for the global services market, 2.7 billion of that is coming from the Philippines. So right now, as it sits today, over 50% of the global healthcare, life sciences support services market is coming from the Philippines. That's pretty significant. It's very rare to see someone that dominates an industry so well. And so the big question is how does the Philippines dominate this industry so well? And now we can go to the next slide, please. And it's simply because if you look at what's happening in healthcare, there's pretty much, if there's a service that's being done in healthcare services and support, there's a pretty good chance it's being done from the Philippines. So the HIM industry support provides support in almost every aspect that exists in the sector, covering the 4 major areas: insurance, providers, being the hospitals and clinics, pharmaceutical, and of course the technology that makes it all possible. As represented in this slide, you can see that the functions overlap into other areas. Billing, say, for both insurance and for providers. Drug utilization review spans across both pharma and insurance areas. And again, technology kind of bringing the data analytics, the data security, the artificial intelligence, and RPA that's changing the way business is done, kind of encompassing for all of this. So I'm not going to go too deep into the individual pieces on this slide, because I know, John, you and I were going to talk a little more about what we had done as we kind of built up through Medical. So if we can go to the next slide. And really, by far and away, I mean, obviously, why do we have more than 50% of the market? Obviously, we're doing a lot of services, but the biggest reason truly is the people and it's the talent. The major reason the Philippines is a destination for HIM support services is the unparalleled size of the healthcare educated workforce. In 2019, the NCSBN, which is the board that governs all of the NCLEX tests, and the NCLEX test is the test that you need to take to become a USRN. So you have to be a certain amount of an educational level, and then this is the exam you pass. Regardless if you're in the US or anywhere around the world, this is the test you take to become a US registered nurse. And this slide represents that internationally trained first-time takers of the NCLEX exam. So this is taken directly from that report, and you can download that report from the internet if you wish to look at it. I listed the top 3 countries by volume, and it's very clear that with 9,918 test takers, the Philippines clearly dominates over the number 2 India and the number 3 Puerto Rico, which have 1,177 and 1,001 respectively. So it's clearly, if you look at this, over 60% of the internationally educated NCLEX passers come from the Philippines. And another important part to look at this is if you look at the pass rates, again, there's just an infrastructure here for healthcare and in that domain. The pass rates are at 44.4%, which is right in line with the entire rest of the world. So obviously, again, it's taken very serious. There's a good infrastructure for it. Not every job and every position requires you to be a USRN. So we know that there's other positions, but it certainly benefits if someone has a healthcare background, has that healthcare education, because it's a lot easier to take someone who's got the inherent healthcare knowledge and teaching them your particular focus and your particular processes that you want them to work on. So again, for 2018, there was over 42,000 medical allied health degree college graduates from the Philippines. More than 9,000 of those had passed the Philippine nurse licensure exam, and nearly 5,000 had passed the Philippine pharmacist licensure exam. So again, back to that slide with all the different aspects of buckets that you saw, you'll certainly see that there is talent here that can really help you approach any area of the business you need to do. And then to the last slide, please. Next slide. It's not updating for me. Did we go to the next slide? I don't see it. There we go. And this slide here is, again, as we talked about, who is HIMAP. Again, we're 60+ member companies. If you look at some of the companies you see that are here, we've got from the largest BPO companies that are truly in the world to some very small and boutique and very focused entities that are have a very precise focus on maybe one particular niche of the business. But again, all these aspects, all the things I showed you on that slide before, are functions that are being done by companies that are here. So I think I can end this part of the presentation more with a question to you, and it's just simply, if you're not supporting your healthcare operation from, with help and support from the Philippines, the question is, why not? Because so many other are. So that's that for that. John, I'll hand it back to you.
Okay, thanks, Jeff. Put into perspective what the current situation in healthcare services is in the state of the industry in the Philippines, to understand the path and how you arrived at this industry. So spend a few minutes in the history of the FIO in the Philippines. And that's a topic I are intimately familiar with, as we were both co-founders of a company called Medicall in 2003. We were a pioneer solution there were some minor healthcare services being provisioned outside from the Philippines to the U.S. in the area of medical script. Our vision was to tap the tremendous resource in the Philippines, educated, breed, nurses, doctors, and form very healthcare knowledge outsource lower level functions. Target markets were large U.S. payers, workers' comp companies in the United States, TPAs, and we evolved into provisioning services for life science, pharmaceutical, and PBM companies in the U.S. as well. We have very key focus on the workforce that we were going to utilize into performing those services. And maybe you'd like to touch on that a bit. Jeff?
Sorry, talking on mute doesn't work, does it? So obviously, we went for a very highly focused clinical aspect. Our entire operation was as much clinical as it possibly could be. Obviously, we had some support and finance services, but for the most part, we were all clinical. And we truly wanted to focus on the upper end of services. So it was finding people that had not only were healthcare educated, but also had healthcare experience. So, they had been working in hospitals or in clinics in other areas, or in some cases at other centers. So they had a good baseline for us, but we still had significant training to do. I mean, again, my lesson from my job before was if in a foreign, different cultures, things are different. So we really tried to have to develop our own U.S. Healthcare 101 training programs to understand the U.S. healthcare environment. And then there was certainly a lot of uh, aspects for once we had taught them how the U.S. healthcare went, we also had to give glide paths for them to show them how they could progress up through it. So we create our own internal NCLEX testing programs so that our nurses that may start with us on one level, say maybe on the intake portion of it, can get the education while they're working and work their way up to become a USRN and do the true claim adjudication piece of it.
Key to performing these services, and actually a preliminary requirement, was to obtain the appropriate regulatory and compliance requirements and infrastructure. So we had to deal with the regulatory and compliance teams with multiple clients that we were targeting. Actually, we had to deal with state regulatory agencies and workers' comp and healthcare as well, and engage in audits by those organizations. And really a key focus that legitimized services from the Philippines was an independent organization called URAC, the Utilization Review Accreditation Corporation. And this is an independent body that regulates the industry through their accreditation and audit program. And we'll have a bit more on that later. Basically, after, starting the company in 2003, we were acquired in 2012 by the second largest BPO in the world, a company by the name of Cognizant. Jeff and I both stayed on for a period of time after the acquisition to help with the transition and meld our organization into Cognizant's. And during that time, we continued to expand in the healthcare and services segment and grew the team to over 1,500 staff. Next slide, please. So, next slide, please. So to touch more on the pioneering services that we offered, we literally started with the organization by crawling, then walking, before we ever got a chance to jog and run. The first key service we offered was literally fax intake using Philippine licensed nurses. We were able to prove to our major US payer client that the team certainly could perform the service at a very impressive quality and productivity level. So that led to additional services, the next being full-blown utilization management. And providing that service required US licensed nurses, full URAC accreditation, and that really led us on a very upward path and expansion. And from that, we were able to leverage our services within other organizations. And it seemed like every time we would start with a company with one service, they would come back and request additional services. So we end up even expanding out of clinical services and started using Philippine healthcare professionals in order to provide services such as claims processing, credentialing and re-credentialing, clinical review of claims. So we really started to expand our level of service offering.
Yeah, John,
Jeff,
and
you want
we expanded even into the pharmacy side of it from the life sciences side. We had nurses that were doing jobs that were credentialing doctors for clinical trial work and helping to identify patients for clinical trials. We had also done again some drug utilization review, some PBM support. Another interesting one to call out. I love to say this because I think we were ahead of our time. It was as early as I believe 2010 2009 maybe, we had a live nurse chat support that we were doing for one of our clients. So while telemedicine now is all the rage and everyone's finally catching on to it, we can talk about we were doing this 10 years ago, where we had nurses that were providing clinical support and help for people that they would kind of come in. And we were shy of triage, but we were certainly offering good healthcare information for people.
Next slide, please. So part and parcel to any establishment of a healthcare clinical operation really focuses on regulatory and compliance in a variety of different areas. You know, we all understand that that IT must be secure. There's HIPAA requirements, but really to address the needs in the U.S., you have to have very solid infrastructure for regulatory compliance. So for that reason, gosh, way back, I think in 2007 or that period of time, I personally approached URAC and requested them to investigate the potential of accrediting an offshore organization. And literally, that first meeting, they flatly said that they would never accredit an offshore organization. So it took a long year to really educate the board and the team at URAC that this was a very legitimate operation with high quality personnel providing the services. It was a long road traveled, but I'm happy to say that our team was recognized at the URAC annual convention as being their pioneering partner in offering offshore accreditations. So you can see from this timeline, we literally pioneered the regulatory offshore over a period of time. And I was the one that literally got the ball rolling, but as usual, I punted the ball over to Jeff because he had the challenge of actually implementing and going through all these audits.
Yeah, and I don't want to take too much time, but I think the important thing when you look at it is back to my history before from setting up IT ops around the world. When we were given the, like I said, John opened the door to URAC, and then they says, okay, here you go, here's what you need to do to accredit. Once we got it and took a look at it, the similarities to ISO certification were very, very similar. So having experience with that and understanding how to do that, and the important part of going, how do you make processes? How do you really just go by the basic tenet of you say what you do and then you actually do what you said, right? So how do you document that? How do you put those processes in place? How do you make sure you have your own internal regulatory team that holds you to the fact that the things that you say you're going to do, because there's quite a lot of things. So it is quite intricate. There's a lot of moving parts to it. But again, if you look at it systematically and treat it like an operation, you can get yourself through it. And obviously we've proved that. There's now numerous URAC accredited companies here in the Philippines. And I'm happy to say that we were the first one to kind of really make that happen at this level.
Next slide, please. I'd like to segue into KMC, who we are, what we do, and really Sarah's going to really focus in a bit on what we have done as an organization to address operations during the age of the Corona lockdown and what KMC has instituted in order to facilitate services from the Philippines. So a bit about KMC. KMC, I would describe as a facilitator of U.S. companies who are desiring to establish their own operation, their own footprint in the Philippines. KMC has 1,600 plus direct employees, and we're located in various facilities throughout the Philippines. We actually have over 16,500 workstations currently in operation in 26 office locations throughout the Philippines, 46 managed floors, and over 90,000 square meters of total workspace. Next, we'd like to just do a quick poll. We've come up with a question. We're very interested in knowing what the biggest concern of your company is today and facing the challenges during the age of Corona. And we've got 6 selections for you. We'd ask in the next 15 or 20 seconds, if you would please pick one of these topics. I think they're all pertinent, but it would be interesting to share with the group what we think the key concern is. So we'll wrap that up here in another 5 seconds. So please submit your response. Well, it's interesting. Coming in, it looks like loss of revenue is the leading concern during Corona, with a lot of staff being furloughed, working from home, lockdowns. The second is uncertainty, which certainly makes sense, because we don't know if there's going to be a second wave. We don't know what the future holds. So I think the key is to attempt to build an infrastructure that can address business necessities during this age of uncertainty. Next slide, please. So KMC has a pretty substantial footprint throughout the Philippines. Next slide, please. So as you can see, we have a major focus in Metro Manila with 14,000 plus seats. Metro Manila is a huge area with over 25 million people. It's one of the largest metropolitan areas in the world. We have multiple facilities in multiple cities that comprise Metro Manila. Our offices and headquarters are in BGC, Bonifacio Global City. We have operations in Makati, Ortigas, Quezon City, and Mandaluyong. So as you can see, the major focus for the company is tapping into the talent in the Manila metro area. But a lot of our clients have interest in expanding into the provincial areas for a lot of reasons. One major reason is for disaster recovery and business continuity purposes. So some of our clients have operations, their major operations are in Manila, but some branch out into some of these provincial areas. And there are some other benefits to operating in provincial areas that we look forward to sharing with you in the future. We've got some additional information. I know Jeff's focused on only healthcare, but I did want to point out that the educational system in the Philippines is really impressive. It's based on the U.S. university system that was instituted at the conclusion of World War II. We have over 700,000 college graduates a year. There's a big segment in engineering. A lot of the existing workforce is upskilling in a lot of industry programs utilizing data and analytics. There's some pretty impressive statistics. In 2019, the Philippines was recognized as the 3rd most improved global workforce in the world. So some of this information is pertinent and certainly supports what Jeff had shared with you previously. Next slide, please. Quickly, I believe one of the main reasons for the success of the Philippines, really, there's 2 reasons. One is education, the education system, and the second is the fact that the official language, most people don't realize this, the official government language of the Philippines is English. And the Philippines is the 3rd largest English-speaking, most populous English-speaking country in the world. So according to an annual test, the company ranks very high in Asia in English proficiency. As well, if you look at the overall world BPO marketplace, which is 48 billion, the Philippines has got a 6.7% share of that, which places it as one of the fastest growing economies in Asia. And it's largely due to companies in the US and around the world that have recognized the Philippines and made it their center for offshoring. Next slide, please. I did want to touch a bit on one of the advantages, especially in healthcare in the Philippines, sharing some of this data that we got from U.S. Nurse Associations, the Philippine Nurse Association. As you can see, with no benefits included, these are the current averages in different places in the United States. And when you look and compare it to the Philippines, there's a substantial advantage. And I want to make sure to point out that these are U.S. licensed nurses in the Philippines, and this is the average annual salary without benefits for a U.S. licensed nurse in the Philippines. Next slide, please. And to continue on with this topic, we were sharing a bit of information on other clinical healthcare specialists. So from that other slide, we've got a U.S. licensed nurse. Then we've got a Philippine licensed nurse. And Jeff and my experience over the last 20 years, we have to admit that for the most part, there is not much of a difference with a Philippine licensed nurse and a U.S. licensed nurse. They both have a 4-year Bachelor of Science education. I believe the statistic is close to 50% of U.S. licensed nurses have a 2-year degree. That 2-year degree does not exist in the Philippines. It's a 4-year degree only to graduate with a degree in nursing. So this segment of the workforce simply hasn't gone through and taken their NCLEX exam and the TOEFL exam to obtain and apply for a U.S. license, which can be quite costly. So really the work experience and knowledge, there's not a big difference between the two. Going back to the previous slide, we're also showing the rates for a Philippine licensed pharmacist and a Philippine healthcare administrator. We consider administrators are someone who may have an education in the life sciences area, or maybe went to nursing school but doesn't currently have a license. Those folks are targeted really well for services such as claims administration and adjudication and so forth. So this comprises a lot of the workforce that's providing services from the Philippines. Next slide, please. I'd like to address and review the 3 basic offshoring models. I think we've talked enough about third-party BPO outsourcing. The other end of the spectrum is a fully incorporating a company. And we've got a lot of examples of that. There was a major US payer, United Health, that was a KMC client initially. And they found the model so attractive that years ago they decided to incorporate and build their own support infrastructure to support their operations with IT and HR and facilities management and payroll and so on and so forth. So they incorporated, and to date, I believe the last figure I saw, they have over 4,000 employees in the Philippines. KMC is really a facilitator and has a pretty impressive evolutionary transitional model. Think of us as performing all the functions, A to Z, to allow a company to transition to this model. What we do not do is we do not provide the direct management oversight and training of the staff. We leave that up to our clients. But everything else having to do with establishing an offshore entity is in our wheelhouse. From the talent acquisition, actual legal incorporation, setting up physical operations, obtaining all the equipment, setting up the IT infrastructure, payroll, employee engagement, HR, all of that is what we provide our clients, so they can literally focus exactly on the services that they want to offer and the output, the productivity, and the quality of those services. Next slide, please. So I think what we're showing is that the Philippines is more than just a call center destination. And the next slide shows even outside of the healthcare world, we've had clients that have come to us for healthcare and have come to understand after a period of time that there's tremendous accounting resources or IT support and engineering resources, customer service resources. So a lot of our clients have decided to really utilize their offshore organization to provide in-house shared services functions for their corporations worldwide. One thing we're really proud of, if you look at the graph on the left, during complete and total lockdown in the world during the age of Corona, you can see that we've continued to hire personnel for our clients, interview them remotely, onboard them remotely, and provide them with full functionality with office equipment, technology, connectivity, and support services as they are onboarded and work out of their home. So you can see during a total lockdown when companies are contracting, we've been able to continue to expand when our clients require it. Next slide, please. A lot of this is for reference, but I will point out that we have a highly consultative approach when it comes to talent acquisition. And let's face it, no matter how nice the facilities are and how good the connectivity is, if you don't have the right talent, your operation's not going to be successful. We've seen that currently there's some tremendous opportunity to hire experienced talent in the Philippines. So we work very closely with our clients to calibrate the talent that they need, and then we do all the screening and allow our clients to select the talent, and then we take over with the onboarding. Next slide, please. Just want to quickly share that we've developed our own internal solutions for health, for human resource. We've got our own cloud-based software that allows our clients in the US to really have a tremendous window on their workforce. We've also got a very unique a solution for onboarding, which has helped greatly during the age of Corona. So, we've delved deep into the processes on how to successfully onboard talent in the Philippines. I'd like to turn the discussion over to Sarah. She's going to address the age of Corona and what KMC is doing to support those efforts.
Thank you, John. So the Philippines has been under one of the world's longest and strictest COVID-19 lockdowns. This began in mid-March, and it began pretty abruptly. The country pretty much just shut down. We're now on our third phase of quarantine. So we've gone from ECQ to MECQ to GCQ, all acronyms, but each phase has lessened in restrictions as we've gone along. So now we're in a phase where people can return to work. Public transportation is mostly open, but social distancing still needs to be maintained in public places, on public transport, and in offices, right? So you need to have at least 1 meter between people. And you see that whenever it is that you do go outside. So like I mentioned, when the country shut down, it was quite abrupt, and KMC had to react very quickly to help get clients what they needed to continue operations and to keep their people safe. So if you look on the bottom right, it says thousands of IT hardware deployments. And we did just that, right? So as John mentioned, during the lockdown, we had to mobilize our fleet and find creative solutions to get thousands of IT hardware, computers to employee homes so that they could continue to work and continue to support the businesses they work for in different countries. Now that we're in a less strict quarantine, we're helping move employees back to the offices. People are feeling more comfortable. And obviously, we've significantly increased our safety and sanitation measures, as you can imagine, in all of our offices. With that, I'd like to play a very quick video that illustrates some of the things that we're doing. return to work, there are a lot of questions on how to keep everyone as safe as possible. And so obviously we've been thinking about this as soon as as early as March, we've been thinking about new solutions, and the executive team has been looking at looking at best practices and policies to put in place. So you've seen a lot of this in the video already with the touchless access. These touchless access panels directly integrate with our HRIS system that John talked about earlier. The social distancing measures, we have, employers want their workers to feel comfortable and employees to feel safe in the workplace. So if, as you can see from that video, if you're going back to work, you're going to see a very different office from when you left. Not everyone will be in the office. Maybe people are staggering shifts. People are implementing social distancing. As you saw in the video, there's space between desks. Common spaces like cafeterias are closed to avoid people gathering in groups. And hallways and stairways are one-ways, you can see on the slide here, to make sure that there isn't congestion among coworkers. And at KMC, we also employ hospital grade sanitation and disinfection in all our offices. There's places everywhere where you can, sanitation stations where you can use alcohol, wash your hands, things like that. Next slide, please. Point being that, we've really done our best to make you feel as safe as possible because we want you to feel comfortable coming back. It's at KMC's utmost important. Well, I guess I actually spoke to a lot of the points on this next slide. With the contact tracing, if you notice in the video, she scanned her QR code when she came in. So we also do things like that. What we didn't see in the video and what I haven't spoken about yet is the company shuttles. So because transportation was previously shut down, and then even after it opened up, people need to maintain a certain distance. And so you can only fill half of a car, for example. So we've mobilized our entire fleet of vans to start transporting employees to and from the office. We've done that so that people aren't stressed about how they can get to the office. Some people just need to get back. They have unreliable internet connections at home, or they have too many distractions, or not a conducive work environment. With transportation, we're also going to soon be working with a Singapore-based partner to provide innovative technology-based transportation solutions. So I'll just tease that a little bit, but you should see some info coming out soon about that. Next slide, please. So Casa by KMC is a solution that we developed during COVID times. It's a work from home setup. It's a blended setup actually, where we send a KMC workspace essentially to the home. This was born out of clear client needs and it was something that we were able to roll out very early on into right in the height of the pandemic here in Manila. We know that not everyone's going to come back to the office. Work from home has worked well for some. I'm in a KMC office right now, and I certainly need to come in when I need stable internet connection, or even when I need to collaborate. I was in a different office 2 days ago to collaborate with my colleagues. And so we took a pulse of our client needs, and we sent out surveys to understand what their challenges were. And so some companies or some people were experiencing loss of productivity, right? And that's for a number of reasons. In the Philippines, in some homes, you have multiple generations of families living in a home. And so lack of space is sometimes an issue. Unreliable internet is also a huge disadvantage. And then you also, if you are living in a home with other people, they can also be distractions around you. But the other thing that's interesting, and clients have been pretty vocal about this, is the lack of human connection, but more so that they feel that as employees are working more from home, clients or colleagues feel like they're losing their company culture and that absence of community is something that they feel. So KMC Solutions, you can go to the next slide. So KMC Casa is a blended work from home model. So what we do is, next slide, please. Well, anyway, so KMC is very well positioned to provide a solution like this because it leverages all of the different things that we have. We have a massive real estate footprint. We're in all major CBDs, but we've been focusing on growing outside of the main cities. And so, as John mentioned, we're in Quezon City, we're in Alabang, we're in Clark, Cebu, Iloilo. So that allows our clients to have a home base. So like so this is more about a hub and spoke model. It allows companies to have like a home base in Makati, for example, and then be able to, and allows employees to work somewhere near them. Next slide, please. No, go back. So the the Casa solution is we send home ergonomic furniture, an ergonomic chair, desk. We set you up with high grade, high speed internet. If you need productivity software, we can include that as well, video conferencing, things like that. The IT hardware is included, so that's a laptop, docking station. If you need a noise canceling headset, that also comes home with you. Next slide, please. Yeah, so I touched a little bit on this hub and spoke model. So the other piece of the KMC Casa offering is sort of a passport for employees using this to be able to go to a KMC facility that is nearest them. So me, for example, I can walk to 3 within 10 minutes. And so that's what I do on days that I need to come into the office. And so that has worked, that has been really great for clients. The other way that this works, or the other unforeseen sort of advantage to this, is that there are some employees that this has opened up access to a wider talent pool for clients that we work with. They found client or talent in cities that, like Cebu, for example, that maybe they don't want to work in the HQ in Manila, but they're able to work in an office in Cebu. So that's been really, really excellent.
Well, I'd like to jump in here and share with you a quick case study. It's not a healthcare client, but we think it's a good apropos case study because really this expansion took place during the age of Corona. So I think most of us have used Zoom, if not for teleconferencing and telecommuting, maybe at least on an early Friday evening for a virtual cocktail hour. But Zoom is a well-known company that's expanding quite rapidly during the age of Corona. And at the end of last year, actually before Corona hit, they determined that they needed a local partner to help build out their Southeast Asian hub and support center for US operations. So they needed highly qualified manpower and office space and a partner who could quickly meet their needs. Next slide, please. So we leveraged our tremendous network of talent acquisition. We did a lot of advertising through our network. And as you can see, we promoted the fact that KMC's building a world-class team for Zoom in the Philippines. So we were able to leverage our branding, and as well as we presented candidates for our client to interview, and as they determined who they would make offers to, we handled all of the onboarding and development and delivery of all the necessary equipment to them to be able to work remotely from home, as Sarah outlined previously. So in a short period of time, we delivered over 100 computers and IT kits to this remote workforce prior to their ability to come into a KMC office. So we instituted an internal referral program, and we were able to source a lot of key talent that had been either furloughed or temporarily laid off from their current employers. So, we're excited to have them as a client and to perform and help build their organization in Manila. And we're also building the first Zoom rooms in the Philippines. So these will not only be utilized by Zoom, but they'll be available for use with a lot of the other clients that KMC has in other facilities. Lastly, our last slide, just want to share with you some of the logos and some of the organizations that we've dealt with over the years. Some are previous, some are current, and as you can see, it's quite a diversified portfolio. Interesting to note that some of the organizations are actually BPOs, and as they have needs and expansion requirements, they've utilized KMC for our ability to react quickly and maneuver in the marketplace and help them meet their business goals. So that concludes the presentation. We hope it's been valuable for you. I think we've got a few minutes left. So we sent out requests for questions prior to the webinar, and over the last day or two, we've received some questions. So we thought we'd share these with the group. I'll go ahead and take the first question. What are the most significant advantages of the KMC model versus the BPO model? I really think there's two key advantages. If you really analyze the BPO model, there's usually a US-based management team that is interacting and managing a third-party BPO management team, who then in turn manages the workforce. And with the KMC model, we literally eliminate that mid-management layer and cost, which provides our clients with much more control over their operations. So it's a matter of control and cost. And since KMC does not mark up salaries at all, we're just charging for transparent services. This elimination of management and no markup of labor certainly makes a big contribution to lowering costs. So it's a very cost efficient and very efficient interaction between the clients and their staff in the Philippines. And it usually results in significant improvements in productivity and in quality, because our clients really control the output of the staff that we've hired on their behalf. Jeff, you want to take one of these other questions?
Sure. Actually, it's kind of interesting, John. Questions 2 and 3 kind of blend together. I'll take question 2, but I'm going to use question 3 to feed it. So the question is, the Philippine educated clinical talent, specifically nurses, comparable to the U.S.? Yes, they are. The education system here was based on U.S. curriculum. Again, with HIMAP, we've actually worked with CHED, the Commission of Higher Education, and we've actually worked with them to update some of the curricula to kind of bring some of the nurse informatics more into the now. So they are definitely 100% on par from a clinical aspect and from an educational aspect. But going into the question 2, or what are some of the biggest challenges is, I think it's assume nothing. It's a different culture. Things are a little bit differently. So you just got to kind of walk into this with the aspect of understanding. You want to teach exactly what you want people to do, because if you don't spell it out right, you're going to find challenges when you didn't explain it. And then the second biggest part of operating or challenge, or how you deal with here, is really having a partner and having people you can trust that are here to help you make it happen. We didn't have a lot of those luxuries when we came here in 2003. Remember, John? I mean, we were lucky enough that we did find a good partner that helped us a lot, but we had a lot of challenges. There was no seat leasing opportunities. There was no, getting a lot of these things as a service that you see now today from a lot of the software and hardware functions you can get. So we we kind of had a higher capitalization need. And now today, this everything as a service model really makes it a lot easier. So the challenges are significantly reduced in that regard. But again, I think the biggest one is just making sure you have your focus, clearly understand what you're looking for, and make sure you clearly express that so that it's understood, because that's when you'll find things work the best.
Well, thanks, Jeff, and thanks to all of you who have attended. On behalf of Sarah and Jeff, I'd like to thank you for your time today, no matter where you are located, and thanks for spending a few minutes with us this morning. Please have a good and safe day.
Thank you.